Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Welcome back to medical junoon lecture. Now we are going to discuss about the abducent nerve, which is also called sixth cranial nerve. Abducent nerve as the purely motor nerve. It supplies one of the extraocular muscle, which is also called lateral rectus muscle. Lateral rectus muscle help in the lateral rotation, mean abduction of the orbits of the eye. Okay. Now we will discuss in this video only the course of abducent nerve, and next video inshallah I will be discuss about the notes and the clinical representation of abducent nerve. Now let's start. Abducent nerve is arising from the bones because the nucleus of the abducent nerve is located in the bones. Okay, so the abducent nerve is arising from the bones. The nucleus of the abducent nerve is located in the bones, so the axon of the abducent nerve is arising from the bones and move toward the ventral side of the bones, not to the back side of the bones. So they move toward the ventral side of the bone. This is bones. This is the nucleus of the abducent nerve. This is the axon of the abducent nerve and move toward the ventral side of the bones. Okay, when they move toward the ventral sides of the bones, they cross a canal which is also called Doraleo's canal. Doraleo's canal. Doraleo's canal is present on the apex of the petrous part of the temporal bone. Doraleo's canal. This is the Doraleo's canal. This is the apex of the petrous part of the temporal bone. So they cross the Doraleo's canal, which is located on the apex of the petrous part of temporal bone, and move running forward. Okay, when they move forward, they cross the cavernous synostoid. This is the cavernous synostoid. They cross the cavernous synostoid on its medial side, not on lateral side. They cross the cavernous synostoid on its medial side and move toward the superior orbital fissure, and cross the superior orbital fissure on its middle side, not medial, on its middle, on its half side. Okay, so they cross the superior orbital fissure through its middle side and leaves the cranium through superior orbital fissure. This is the superior orbital fissure. This is the cavernous synostoid, and leaves the cranium through the superior orbital fissure and move toward the orbits of the eye. In the orbits of the eye, extraocular muscles are present, which help in the movement of the extraocular muscle. Okay, now abducent nerve only supply one of the extraocular muscle, which is also called lateral rectus muscles. So abducent nerve pass through the middle of the superior orbital fissure and leaves the cranium and move toward the rings of the extraocular muscle, which is present in the orbits of eye, and supply only the medial side of the lateral rectus muscle, which help in the lateral rotation and which help in the abduction and the lateral movement of the eyeball. Okay, now this is the nucleus of the abducent nerve, which is present in the bones. So the axon of the abducent nerve is arising from this nucleus and move toward the ventral side, and after they are crossing, they are moving toward the Doraleo's canal, which is present on the apex of petrous part of the temporal bone, and move toward the cavernous synostoid. It passed through the cavernous synostoid on its medial side, not the lateral side, and they cross the superior orbital fissure on its middle side. Okay, when they cross the middle side of the superior orbital fissure, relieves the cranium to and move toward the orbits of the extraocular muscle and supply to the rectus muscle. Thank you, Jazakallah.